Hey everyone, I'm Eric. Today, me and my team will be talking about measles. So in this presentation, we'll focus more on what is measles, what causes measles, and what are the symptoms of measles, as well as how it affects people and how to prevent it, especially among the young children. What is measles? Measles is an infectious disease which is mainly caused by the rubella virus, and it attacks the human body easily by its air transmission. In example, sneezing, coughing, and physical contact with an infected person. This disease happens very common among the young children, especially the 5-year-olds or the younger who have not been vaccinated before. According to the World Health Organization, in 2015 alone, there were 134,000 deaths caused by measles. And there are several risk factors which causes measles includes frequent visit to the endemic areas, deficiency in vitamin A, and also not being vaccinated.
So the disease will start developing 8 to 12 days after the infection. In the early stages, the patient will experience signs and symptoms such as fever, coughing, conjunctivitis, and inflammation of the mucous membrane in the nasal cavity. These symptoms will worsen and the patient will develop bluish white spots in the mouth called Koplik spots. These spots will disappear within a day. A distinctive sign of measles are rashes, and these rashes will be seen throughout the body and will eventually fade after a week. A fever will also accompany the rash, and once the fever subsides, a persistent cough will last 1 to 2 weeks after.
What is the prognosis of measles? An estimated 60% of children infected with measles will heal naturally. However, 40% of the cases will develop complications, one of which being subacute sclerosis panencephalitis, or SSPE for short. SSPE is a progressive neurodegenerative disorder of the central nervous system which is caused by persistent infection of the measles virus. SSPE disease presents seizures and which could lead to death within 5 to 15 years of measles infection, and children infected with measles are 30 times more likely to contract SSPE.
One of the proven ways to prevent measles is through vaccination, as it has been proven to increase prevention of measles by 95%. It improves immunity by 99% and also reduces the spread of measles by 92%. Besides vaccines, there is vitamin A. Vitamin A intake has shown to reduce the mortality rate in children that are already infected and increase the immunity resistance. However, vaccinations are predominant in effective and efficient ways in reducing any form of airborne disease in children, with measles inclusive. These vaccinations can be assessed and administered by general practitioners and pediatricians.
In conclusion, measles is a very infectious disease which affects mainly the young children. And the main symptoms for measles is the rashes all over the body. And although there is no treatment or cure for measles, but prevention can be done like vaccination for children especially. Therefore, parents should be aware about this. Thank you.